previous section, we discussed about the features, the clinical features that will happen if a person has got injury to the cranial cavity, to the brain or the brain stem. In the road traffic accident, there might be injury to the spinal cord. If there is complete transaction of the spinal cord, say this entire transaction of the spinal cord happens, then what will be the clinical features? Below the level of the transaction, suppose it is happening at the T10 level. So below the T10 level, all of the sensation, entire bilateral sensation of the entire body below the T10 will be affected, will be lost, whether being it pain, temperature, joint position, vibration sense, fine or the crude touch, right? And below that level, there will be total loss of the motor system too. There will be the paralysis, right? Upper motor neuron lesion will be there. Okay, now the problem will be if instead of being the complete transaction, there might be situation where there will be half side, half of the spinal cord is getting affected. Just imagine this is the midline, this is the right side and this is the left side. Okay, suppose there is a lesion happening at T10, right sided T10 level, right sided T10 level. Then what all the clinical feature will be there? Sensory and motor. First we will start with the sensory. In the sensory there were two pathways. One was the dorsal column, if you can recall back. The other one was anterolateral spinothalamic tract. What was happening for the dorsal column? The dorsal column means they were staying on the same side in the spinal cord, right? On the spinal cord. And pain and temperature carrying the anterolateral spinothalamic tract, say the anterolateral spinothalamic tract of the this side, suppose it will enter and move along this one, right? So if there is a lesion at the T10, it means this is dorsal column pathway and this is anterolateral spinothalamic tract. Dorsal column carries joint position, vibration, all these sensations, right? Joint position, vibration, fine touch, 2-point discrimination, right? 2-point discrimination, stereognosis, and anterolateral mainly carries pain and temperature from the opposite side because they will cross over to the opposite side. So if there is lesion at the transaction at the right sided T10, then below the T10 same side all these sensations will be lost, and below the T10 contralateral pain and temperature will be lost, right? That is regarding the sensory one. Now what about the motor one? The motor one is below the T10, the same side, because this side is okay, the same side below the T10, this upper motor neuron has been removed, so there will be upper motor neuron lesion. Upper motor neuron lesion feature below the T10. And what are those upper motor neuron lesion? There will be spasticity, there will be hyperreflexia of the deep tendon reflexes, there will be the Babinski sign, right? There will be weakness of the muscle. Everything will happen below the T10. All these collection of the symptom, sensory loss as well as the motor loss, this collection is called as Brown-Sequard syndrome. Brown-Sequard syndrome. So Brown-Sequard syndrome, basically it has got three features: ipsilateral loss of joint position, vibration, stereognosis, 2-point discrimination on the same side, ipsilateral loss below the lesion; contralateral pain and temperature below the lesion; ipsilateral upper motor neuron lesion features. Now if we go into further detail, that's all regarding the Brown-Sequard. But if you want to go into further detail, what will happen at the T10 level segment? Forget about above or below. At the T10 level segment, all these upper motor neuron lesion is below the T10 and above the T10 is entirely normal. What about the T10? T10, there will be the lower motor neuron lesion in the case of the T10 on the affected side, right? What about the sensory one for the T10 segment? Sensory one, all the sensation will be lost, because whether they are supposed to cross over at the spinal cord level or at the brainstem level, medulla oblongata level, first they have to enter, and whether it is the joint position sense, vibration or the pain or temperature, all those T10 segment, it has been transacted. So at the level of the lesion, entire loss ipsilateral, entire loss of the sensation, pain, temperature, joint position, vibration, 2-point discrimination, and lower motor neuron type of the clinical feature, because the anterior horn cell has got affected. Lesions of the spinal cord. It can be either the complete transaction, or there can be the incomplete transaction, or there can be the hemisection. So depending on which type of the transaction it is there, it has been subdivided into 5 versions. This type is the lesion of the only the peripheral nerve, peripheral neuropathy, like not the spinal cord is getting affected, but the peripheral nerve, the nerve which are supplying the distal most part of the limbs, both the limbs, upper limb as well as the lower limb, and this kind of neuropathy is called as peripheral neuropathy, and there will be loss of sensation, all type of the sensation will be lost, and this is called as the gloves and stocking sensory loss, like as if there is a sensory loss at the area where the gloves and stockings are wear. Okay, and this most commonly happens in diabetic, okay, gloves and stocking neuropathy. Now the second one is complete transaction of the thoracic cord. As shown in this diagram, if it is happening at the T7 level, there is complete loss of the sensory. All the sensations will be lost below the T7, and below the T7 there will be upper motor neuron lesion features. Okay. The third one is coda equina lesion or coda equina syndrome. This is because our spinal cord, as we know, it ends at L2 second lumbar level. So if the transaction happens of the vertebral column below the level of L2, say L3 or L4, depending on that, those nerves up to the L5 or the S1 or S2, they will get affected, and mostly these nerves supply the perineal area, okay, perineal region. So there will be the loss of sensation of the perineal region, and bowel and bladder habits will be affected accordingly, like which nerve is getting affected. Then there is this part E, we will jump over to the E. In the final we will cover this Brown-Sequard syndrome. This is syringomyelia. We have covered in the previous classes. Syringomyelia is this one we have covered in our previous lectures, like there is a cavity within the cervical cord, and if there is cavity within the cervical cord, what will happen? That cavity will enlarge, keep on enlarging, and the pain and temperature carrying anterolateral pathway, they crosses over at the anterior commissure. So they are the one which will get affected first. That's why there will be the loss of pain and temperature of the segment involved, and it will keep on expanding, then more and more feature will come. Now coming to this hemisection, hemisection of the spinal cord, and it will lead up to the features, and that collection of the symptoms is called as Brown-Sequard syndrome. So in this diagram, the level of the injury is C8 as shown over here, the C8. Then this side, the loss of the motor function, the entire loss of the motor function will happen. Then there will be the loss of dorsal column pathway sensation, that is the vibration, proprioception and light touch sensation on the ipsilateral this side. And what will happen to the opposite side? There will be the loss of pain, temperature and crude touch on the contralateral side. Why? Because these pathways, they will cross over to the opposite side, to the affected side, they will get affected.